Welcome, Dr. Bhartiya. It's great to have you on Health Stories Speak, which is a YouTube channel where we share experiences of health conditions and learn from each other. I think today's episode is different because Dr. Bhartiya is additional director at Fortis Gurgaon. She's a medical doctor and she's an eye surgeon. So she's going to share with us some tips and useful information on glaucoma because she's a glaucoma expert. So welcome, Dr. Bhatia.
Thank you so much, ma'am. It's a pleasure to be here.
Yeah, I just wanted to share that on our YouTube channel, we had one of the patients share his glaucoma experience, closed eye glaucoma. And what he told us on the channel was that that there are no symptoms. He had just gone for a normal checkup and there were no symptoms. And that was very alarming to a lot of viewers. And in the comments, they were saying, what do we do if there are no symptoms? So maybe you could share some tips about what to ask the doctor if, the eye specialists don't on their own check properly. And what are the tips? What is it that we should look for? Over to you.
So glaucoma has no symptoms, period. Very rarely and towards the end stage of glaucoma will you have any visual disturbances. Angle closure glaucoma is a subset of glaucomas. There are two major kinds of glaucomas where the drainage angle remains open or the drainage angle is closed. Closed angle glaucoma has one subset called acute angle closure glaucoma where you will have symptoms. These will range from red eyes, acute pain, watering, decrease in vision. But this is very, very rare. And at least in the kind of setups that we live in, where preventive health is given precedence, it is rarely seen. Now, the problem with glaucoma is that you will never know until the very end that you're suffering from glaucoma, and it can only be picked up on a routine eye examination, what is called a comprehensive eye examination by your eye doctor. So your regular chashme ka number ka check, where you go to an optician and ask them to see if your glasses are doing fine, is not enough. The risk factors of glaucoma, let's start from there. So that's simpler for you to know. You're at higher risk of glaucoma, much higher risk of glaucoma, if anybody in your family has glaucoma. So it's a disease which is inherited. But that does not mean that if your parents did not have glaucoma, you won't have it, because more often than not, it's not being picked up, or it does happen de novo. So family history is right up there. Glaucoma has two age peaks. Angle closure glaucoma, a higher incidence is seen in younger patients around in their 40s, and open angle glaucoma is more commonly seen in the 60s. But again, these are just peaks. It doesn't mean that either side of the age you won't have it. If you've been on any kind of steroids, you're at higher risk of glaucoma. Right. If you've had any trauma on the eye or any eye surgery, you're at risk for glaucoma. If you wear glasses, either plus or minus, you're at risk for glaucoma. As many as 10% of Indians above the age of 40 are suspects, and they require annual examinations for glaucoma. So 1 in 10 people that you and I know above the age of 40 actually needs to be investigated for glaucoma. So that's important to remember as we step into the World Glaucoma Week that starts week of the 9th, next Sunday, you must go for your annual eye examination and you must know your family history and your history and discuss it with your doctor.
So you said 40 plus and 60 plus. These are the two age levels that we should be conscious of. So what is it when you go and visit your eye doctor? Suppose they miss out on this. What is it that you ask the doctor to check in your eyes?
One, you believe your doctor is not going to miss things out. Faith is so important in the practice of medicine. But if you do want to ask questions, pointed questions, you ask, is my eye pressure normal?
Right.
Right? That's the first question to ask. The second question to ask is, does my optic nerve look healthy? And the third question to ask, is my anterior chamber of normal depth? Or am I at risk for closed angle glaucoma? Right. pointed questions. Very often they might prompt your doctor into seeing you a second time, or maybe even ordering an investigation, which may or may not be necessary. But since you asked, but
Right.
all of us are trained to look for this, and it's part of the service that we give to you. Uh, I think that's where this is, but you can always ask. I mean, it's a good thing to ask.
Right.
If you have a frequent change in your power of glasses, that is also something that requires attention. So you must ask if your power is changing very frequently. Is there a risk of glaucoma that we are looking at?
Right. And in terms of the investigation, you mentioned about the investigation. So, what are
Yes.
the kind of tests? I know this is something that the doctors know, but just for the patients also to be aware, what kind of tests are done and what is the kind of treatment which is done? Because one of the things that the earlier speaker who spoke on glaucoma said that they had to open there's a minor,
Replenishment.
yeah, there's a laser surgery. So just for the people to be aware that not to panic, is it a simple process and is it curable? So a little about that.
Glaucoma is not curable.
Right.
Glaucoma is treatable, which means like diabetes or high blood pressure, you're under lifelong care, but we know enough to make sure that your vision is not hampered or the progression is slowed down so much that at least during the time that you're alive, you get to see clearly.
Okay.
Okay, so investigations of glaucoma are broadly divided into two. One will be the structural investigations, the second will be the functional. So glaucoma typically affects your peripheral vision. So functional testing involves testing your visual fields.
Right.
Structural testing will involve testing the drainage angle of the eye. The test we usually do is called gonioscopy. And sometimes we will also do what is called an anterior segment, OCT. To check the back of the eye, we look at you on the slit lamp, which is how you usually have an eye test, and then your doctor may ask for a set of pictures, photographs, or a retinal nerve fiber layer, OCT, which is a finer index of what is happening on the optic nerve. After this, we may ask to check for your central corneal thickness, because that represents the ability of the eye to withstand higher pressures than normal. And
Right.
also, some of us prefer to ask you to get either multiple eye pressure recordings at different times of day, or we make you drink a lot of water and check your pressures every 15 minutes for an hour. But that's very individual to each practice.
Right. So maybe you can share about the treatment also. How long is it and how do you manage? You said it's a treatable disease.
Yes, so which means that if you have open angle glaucoma, you're going to be on treatment for the rest of your life.
Right.
So we usually start with eye drops. Surgery is something which is called a reserve procedure. So if we can't handle the case with eye drops, only then usually do we turn to surgery. There are certain newer surgeries called MIGS, which are being offered in the earlier stages of the disease, but the jury is still out there as to who's eligible for that or not. For angle closure glaucoma, however, we have to do a laser procedure called laser perifluoridotomy. It's a 2-minute job. Your
Right.
vision is fuzzy for about a day or two, and then things get restored to normal. After which we decide, do you still need eye drops or not?
Right.
Open angle glaucoma also has lasers that are used for taking care of it. So it's three-pronged, basically. There's medical, there's laser, and there's surgical.
Right. Would you like to share any other tips to keep our this question is not necessarily linked to glaucoma, but the tips to keep your eyes healthier. We do a lot of other exercises, but I don't think, at least I speak for myself, I don't think we do enough for
The
our
eyes?
eyes. Yes.
Okay. So the first thing, and I'm going to focus on glaucoma, then I'm going to talk about general eye health. The first thing to do is to always remember that if you're using any kind of steroids, you must make sure your eye pressure is checked. And we often indiscriminately use eye drops.
Right.
Pharmacies give you all kinds of eye drops. The cheapest and the most fast-acting ones are steroids.
Yeah.
Usually, if there has a suffix of ONE, it's a steroid. And just Google and check if it's a steroid if you must. Avoid self-medication in the first place, but if you
Right.
must, then make sure it's a preservative-free lubricating eye drop. Take frequent breaks when you're on screens. Remember to blink more often. You can do warm compresses, not hot, warm, gunguna pani.
Right.
Do a fan compressed over the closed eye. Keep your blood pressure, blood sugar, and cholesterol under control. Healthy eyes can only live in a healthy body.
Right.
Make sure you can reduce your screen time as much as possible. Remember the 20-20-20 rule. Every 20 minutes of screen time, close your eyes for 20 seconds, open them, look at something really far away, we say 20 feet away, before you come back to the screen. Keep your diet and weight under control. Red, yellow, green, orange fruits and berries and vegetables are very, very good for your eyes, just as for the rest of your body.
Right.
Omega-3 is yet another nutrient you need to remember. So salmon and tuna, fatty fish, walnuts, flaxseed.
Thank you very much, Doctor. These are really, really very useful tips. And I think I like the 2021 the most because increasingly more of us, everybody of us, including the babies, are looking at the screen all the time.
Yeah.
And I have to admit I'm guilty of this, of not doing it. I'm going to try and remember it. While we have you, could I ask you a slightly different question about the floaters?
Floaters can be part of an aging degenerative process. They can also be portentous of a serious disease.
Right.
So in case you have floaters in the eye, please make sure you get your doctor to do a comprehensive dilated eye exam. The thing to do is to remember that if there is any increase in the number of floaters, any flashes of light that you see, any decrease in vision, any curtain-like structure that comes in front of the eye, these are ocular emergencies. This means you go to the doctor immediately. Any recent onset of floaters mean you get an eye appointment, get to see your doctor, and until your doctor gives you an all clear,
Right.
no heavy weights, no straining at stools, so avoiding constipation, no heavy exercise, and no bending forward until your doctor says you can. Stay healthy, stay happy. I think, like I said, healthy eyes can only be part of a healthy body.
Yeah.
Do not forget your annual eye exam. Remember to wear your glasses. Sunglasses help no end. They protect your eyes from not only the pollutants,
Yeah.
but also particulate matter and from harmful UV rays. So look for one which has 100% UV blocking properties. Eat healthy, exercise, smile.
Yeah. Thank you so much. I think before we end, I would also, with your permission, would like to share that Dr. Bhartiya is doing great work with her Vision Unlimited NGO, which is really, I've seen pictures of that, and these are for underprivileged children, education, and not only just running the school, but also their proper health checkup, tying up with the local authorities for polio drops. So we are grateful to people like you.
You're so kind.
Thank you. Thank you so much for coming on Health Stories Speak.
Thank you.
Thank you.
It's a pleasure to have been here.
Thank you.